President Trump unveiling Thursday a framework of proposals to address healthcare costs.
Democrats have attacked Trump and Republicans in recent months for failing to extend the Affordable Care Act tax credits that expired at the end of the year. And it appears this is the president's response in order to stifle that line of attack heading into the midterms. Trump has dubbed the framework the Great Healthcare Plan. Take a listen.
I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. I'm calling on Congress to pass this framework into law without delay.
According to the White House, the biggest change in the healthcare plan is where subsidy dollars are going. Instead of subsidizing healthcare companies, the money will go directly to eligible Americans. The plan also targets prescription drug prices and pricing transparency. Senator Roger Marshall, a doctor and a Republican, praised the new plan on X, writing in part, "This plan includes so many of the important healthcare initiatives we've been fighting for in a comprehensive package. Price transparency is exactly what my price tags bill delivers, lowering costs for every American. We also must put patients back in control of their own care."
But some on the left were a bit more skeptical. Filmmaker Morgan J. Freeman, who now, no, not that one. That's what I was thinking as I read it too, wrote his post, quote, "Trump has revealed the Great Healthcare Plan, which will give families $2,000 annually to purchase their own health insurance. The average annual health insurance premium for a family is $26,000. His proposal will cover 28 days of health insurance and leave families uninsured for 337 days out of the year. Maha, baby." And political commentator, I can't even read today. Political commentator Ed Krasenstein wrote in part, "Are Trump supporters really falling for this garbage? The current subsidies of the ACA go to American citizens, not to the insurance companies. This changes nothing other than the fact that you will get the money before you buy your insurance instead of after. More gaslighting from Trump."
Yeah, this is a one-pager with very scarce details.
I'm so happy that you said that.
Let's be real.
I don't want to just argue that this, but I did say I wanted to hear something from the Republican side.
There's something.
So let's just start there, because I was like, you can't keep bashing how much we spend on health insurance and how broken the system is since Obama days. I'm not even talking about recently, and have no real plan pushed forward. This isn't still not a real plan. But it's a word, like a couple words.
It's a step forward, I guess. But yes, it's. I wouldn't call it comprehensive. We haven't even seen the legislation yet. And as we know, the legislation is where all of the icky stuff is always hiding. And there's always all of these kickbacks that are thrown in there and treats for lawmakers. And so I want to see the actual bill. There's a couple of things in the plan that I do like. The idea of the most favored nation drug pricing. There's no reason why America spends all of this money in research and development to have these very innovative drugs and medicines, and then Europe gets to pay half the price that Americans pay because of their government-run system, and we have to basically foot the bill for all of the good research and work that we're doing. So I appreciate that we are trying to lower drug prices. I like the idea of price transparency at hospitals especially. It is the case now that, you get an ambulance ride and you don't know how much it's going to cost you until the bill comes in. But even then, that's not what you ultimately pay if you're on health insurance, right? And so a lot of that obfuscation leads to hospitals and other providers being able to jack up prices because we never really see the true cost. And so there's some elements of this that are positive, but is giving people $2,000 a year as a stipend to help offset premiums that are, really 300%.
Yeah.
In recent years, that's not a real solution to what people are feeling.
And we know that extending those ACA subsidies was a COVID measure that kind of still kicked the can down the road. And we always wait until the last minute to try to make some real change. And
right.
Here we are at the last minute.
Yep.
There's examples. I was reading a CBS News article. One woman, a social worker, went from $75 to $850 a month. Unreasonable. If she doesn't have health insurance, I would understand why. Another woman was explaining how her premiums rose so much that she's just deciding to keep her kids covered and not herself. And I think when you're facing those choices and in the moment, maybe the best solution is to push the ACA subsidies through and not neglect those, at least for the next year or 2 years, to make sure that people are covered, while you know that it's going to take a long time to implement, hopefully, what we see as a bipartisan solution to healthcare. Because the biggest goal is to figure out how to get these costs lower in the immediate future. I think the president is worried about the midterms. Well, people need to see change immediately. And we know that the subsidies, whether you like them or not, actually did bring costs down. And we know that you can go back and blame healthcare and Obamacare about the prices rising in the first place and taking away some choice. But here we are again. And so I just want people to come together and sit down, and maybe Congress will actually get better ratings on how much of a good job they're doing if they can figure out healthcare. I mean, it affects almost every single American. And, the choice part of it sounds awesome in theory, but sometimes with ACA rules, there are a little bit of red flags that stick out, like insurers could sell cheaper plans that don't cover pre-existing conditions again. And we could be back in that era where people that have any type of ailment automatically get denied coverage. And so I think that we have to make sure we're protecting even the most vulnerable of Americans, not only the most young, healthy Americans, and make sure that our system really is working and effective for all. And hopefully this conversation, because it came from the president, can start a real dialogue in Congress about what a way forward looks like.
And it's tough because there has to be a balance between making sure that young, healthy people are not paying exorbitant prices for health coverage that they don't need, while also making sure that you have a big enough pool of people in the system to bring prices down for people who do have pre-existing conditions or require more comprehensive healthcare plans. And one of the things that was proposed during the Obamacare debate was this idea of letting people sort of pick and choose the different elements of their plan. So for example, if you're an older couple and the wife has gone through menopause, maybe you don't need childcare coverage, right? Or birth coverage, things of that nature. But what ended up happening was that all of the plans were sort of one size fits all. And so people just looking for a basic, PPO or paying over $1,000 a month on their premiums, even if it had all of these things included that they didn't necessarily need. And so there was an issue with the trade-offs that were made in terms of getting the ACA passed didn't really reflect the reality for most consumers. I think one of the issues with the subsidies and the extension is it's possible that if you do extend those for another year or two, where is really the incentive then for Congress to hammer out this plan in the meantime? Because we know that Congress does not like to, as you said, get ahead and do legislation when things are humming along fine and people aren't complaining. And so does that just give them more reason to wait again until the end of the next year and try to do something last minute again? And so, ultimately this comes down to Congress is not doing their job, but I 100% agree that this plan is not, it's not comprehensive enough. We don't have enough details to say whether or not this is going to be this sort of silver bullet that Trump is hoping for to stave off a massive midterm loss.
And it's also just frustrating because when you think about, really, it took over a huge portion of last year, our government being shut down, and how many people were affected that work in or around the government that just are probably just now receiving some of those funds if they were furloughed or waiting to get paid or still working without pay, like a lot of people who worked in the airport. And so I think that when you look at how many people were affected by this supposed democratic fight to save healthcare and to get in the new year and nothing changes, I don't know how that will help anybody in the midterms that is watching. Let's use the example of the dramatic example of the woman, and not everyone's will go up this much. Some people $200, but even the person that goes $350 to $550, or the dramatic example from CVS that goes $75 to $850 if she decides to keep it. That's going to be 9 months of her paying $850 if Trump's plan is not implemented before November. And so I don't see how this affects them in any way in the midterms unless they get these prices down before November. A new poll shows State Rep James Tallarico leading House Rep Jasmine Crockett for the Democratic Senate nomination in Texas. We'll tell you more next.